I'm going to have the next conversation with Dr. Fayemi. It's important that Dr. Fayemi is coming on because, I mean, before he became governor himself, he's a scholar of security, war studies, and so on and so forth. Also a progressive who has worked and spoken a lot about reforms, you know, in Nigeria, structural reforms, and two-time governor of Ekiti State, as well as the chairman of the Governors Forum, which is basically where all the governors of all the states have like sort of a quorum and a conversation. Is Dr. Fayemi on? I got Dr. Fayemi. Yes, Dr. Fayemi is on. Good evening, Dr. Fayemi.
Hi, Funmi. Good evening. How are you?
Very well, thank you. Good to see you.
Good to see you too.
Have you had
even though you've disappeared for a long time.
I'm here now, Doc. Thank you. I'm here. I'm here. We won't have that conversation.
Welcome on board.
I wanted to ask a quick question. If you've been tested for coronavirus yourself?
Yes, I have.
Results?
Not once. Negative.
Negative. There's something about Ekiti because apparently Ekiti does not seem to have any COVID-19 cases yet. Is that a testing result or a result of something special in Ekiti which should be given to the rest of Nigeria?
Well, I'm not an epidemiologist and I certainly don't have a degree in medicine. I don't know what is responsible. We've had our own fair share of COVID-19 virus positive patients, but virtually all our patients have been asymptomatic in the course of experiencing the virus. But we've also had one patient who lost her life in the process due to complications arising from the virus. So I'm not so sure we're that exceptional, really.
I mean, how much testing is going on in Ekiti?
We've roughly tested about 200 people, but that's also due to the fact that we do not have a testing laboratory. We do not have a molecular laboratory in Ekiti, but one is coming on board. We are going to be launching our own molecular lab on Monday. So from Monday, we intend to test over the next 2 months about 10,000 people in our state.
Right. I mean, there's one of the things that has become apparent is that there's some sort of disjointedness in the response from state to state. And as the chairman of the Governors Forum, I was wondering, could the response not have been a collective, cohesive, coordinated process?
It could have been. We've had a federal response and we've had state response. I agree with you that what we need is a national response, and we're moving towards that. The federal government, through the work of the Presidential Task Force, started with targeted testing, basically focusing on those who have traveled and those who have been in contact with those who have traveled. Yeah. That has sort of been ramped up now to test people who have caught it in a community sense. And what we've done, working closely with the federal authorities, is to develop a joined-up strategy. The Nigerian Governors Forum has met weekly for the last 2 months on this. And if you look at the last statement by the president on this, you would notice that a lot of it was derived from the proposals that governors sent to the Presidential Task Force.
It seems like, well, let me ask this question. Oh, by the way, doctor, you're not allowed to cough.
Well, I can assure you that my cough has nothing to do with COVID-19. So I won't give you transmission via the iPad.
Via the phone. That's the governors like the governor of Kano State, the governor of Cross River State, the governor of Kogi State. These are your colleagues. Some of these governors, specifically the governor of Cross River State, has been shown via videos to be seen to be denying COVID and, you know, the ways it presents. The Kogi State governor was reported to have turned away NCDC officials because they shook someone's hands. I don't know how much of this news report is correct. So, I mean, there's a caveat there. And then there's, of course, the whole situation in Kano. So there's you talking the way you are talking and acting the way you are acting. There's Governor Sanwo-Olu acting and talking the way he's talking. There's the governor of Kaduna State talking. It's like a divided house. Are these people member? And I will refrain.
Not at all.
Yeah. So what?
Not at all, Funmi. Clearly, you are going to have local circumstances in the development of this virus. This is a new thing. We're not familiar with it. And the level of preparedness is obviously not the same. Don't forget, Lagos had Ebola. And there is a body of experience that has developed from Lagos's experience with infectious disease. There are also states that had LASSA in a prevalent manner over the last few months. They are also quite better prepared, I would like to think, with the response to COVID-19 virus. But COVID-19 is in no way like LASSA. It's not even in any way like Ebola. It's the most infectious disease. You could just catch it without even knowing that you're going to catch it. It's not by eating something poisoned by rat or getting connected to somebody who had the disease. So we clearly need to develop a much more comprehensive protocol. So what you could say is that it's a learning process for us. And for some governors, they've learned faster than others. What we do at the forum is to share experiences, share knowledge, and peer review ourselves. So I wouldn't go into how much peer learning is going on internally within the Governors Forum, but I can assure you that in states that you've mentioned, I can tell you, for example, that a team had been to Kano from Lagos State. That's not something we would announce publicly. To share knowledge, to share experience. I can also confirm to you that as we speak, we're putting together volunteers from a whole range of states to help in states where numbers are ramping up quickly and they don't have enough health workers or experienced hands to deal with this situation.
The PRO police spoke earlier. The sense I get from it is that they don't have enough funding, perhaps, to tackle this really, really difficult situation. So I don't know where the funding, for example, is coming for the police. I don't know how much funding even NCDC and the capacity they have is. And it would appear that it has become every state for himself, God for us all. So if you're lucky and you're in a state that, I mean, I will speak the minds of the people so that you can address this. I mean, people are talking already that maybe this is an opportunity for us to go into regional governments because apparently this is how things work. It depends on what state you come from. So what exactly do we have to show to people that we have capacity to deal with this? First for your state and nationally. Pardon me that I'm dumping national on you. I will remind you every time that you're chairman of the Governors Forum. That's why.
Okay, Funmi, I'm not going to deny that the Governors Forum is national and we do respond to things nationally, but all politics is local and all responses to COVID-19 too has a significant local component. In terms of support for the police, where that comes from, it comes from us at the local level, but it also comes from the police nationally. And I think the bit of your interview with Frank that I listened to tried to address that comprehensively, in spite of the fact that he said that they didn't anticipate this in their budget. We didn't anticipate this in our budget in states, and we are having to review the budgets of states, just as the federal government is also having to review its budget. But the bottom line is we need resources to tackle this challenge, and we have to review our expenditure and prioritize it to respond to this health challenge. This is the #1 challenge of government in the world, not just in Nigeria. And at the local level, that is also our #1 challenge. We're redirecting a lot of our resources to the health sector.
Doctor, why can't we use the Abacha windfall? We just got $311 million. Why can't we just use that directly for this?
Well, I am not exactly sure how that is going to be distributed. As you know, Abacha loot is money from the federation account. So naturally, even governors have an interest in knowing how Abacha loot will be disaggregated.
You in particular, because people who are young don't know, you're a pro-democracy warrior during the military era, including
yes, I am.
Kudurat and all of that, and you spoke about restructuring.
I was.
You fought against Abacha. This is our money.
I did, and that's what I've just said. I've just said that the position of the Governors Forum is that the Abacha loot, as well as every other loot that might have occurred over the last few decades, was money from the Federation account, and a percentage of that money should be disaggregated and returned to states where they belong. How that happens is something that we too would like to explore with the federal government, but that's a separate argument. The point you're making is, why can't we use it for COVID-19? Why not? To the best of my knowledge, the resources that are coming from the Abacha loot in the past had gone into social investment. And some of this social investment work occurred in the States. School feeding program, what is it called? End Power for graduates that are put in various career paths. All of that happened in states, and the money, to the best of my knowledge, came partly from the Abacha loot. So there's no reason why this also should not come from the Abacha loot. But the important point to make is that as part of the plan that the federal government has put forward, they've done that in conjunction with states. And if you like, I know that there is, for example, $100 million that is being channeled through the National Center for Disease Control, NCDC, which is going to states. And all the 36 states are supposed to benefit from that in their preparation for COVID-19 response. But that's just the tip of the iceberg. That's 36 billion naira. Even if you share it equally, that's only 1 billion per state. And to construct an isolation center and put a testing center in place and then get ready, pay allowances and incentives for our health workers, that's a drop in the ocean. But at least there is something that we're working on with the federal government on that. As for the police, every day that I set up interstate boundary operations in order to enforce the ban on interstate movement, I am paying my police, I'm paying the civil defense, I'm paying our local vigilantes who go into the bush paths and the illegal routes. So what I'm saying in essence is that states are funding their police commands, as well as the federal government is funding the police command. And yet they still don't have all the requisite equipment. They may not have the PPEs. They may not have the protective gowns and all the things that they require. But this is an ongoing discussion that we must continue to push.
I mean, I can come back to the issue of regionalization of the police, of governance. I mean, oil is tanking. We are facing a future without oil. If there's no oil to share centrally, why can't we have a loser, friendlier, generating and regulating national arrangements? It would seem like this kind of situation is force feeding us in that direction, if we look at it.
Well, I said something earlier for me. Ultimately, all politics is local, and ultimately, all policing will become local.
Right.
You cannot police a people if you do not understand their terrain, their environment, their culture, their nuances, because policing is a local thing, and local intelligence is so central to it. Right. And that is why inevitably we almost buy into community policing, whichever name you give it, Amotekun, whatever. It's bound to happen.
Someone's asking specifically what your COVID-19 plans are in Ekiti, and what post-COVID-19 plans you might have.
We started planning for this earlier, and that is why we've managed to address it a lot more confidently in Ekiti State. Even though we don't have the resources of Lagos, for example, we've managed to do our tracking effectively, because we set about this work almost immediately. We had the first case in Lagos. Our task force was set up on the 2nd of March. The first case in Lagos was 27th of February. And we set up a local training arrangement. Our incident action plan was ready. By the time we eventually got a first case around the 15th of March, we were ready. Our infectious disease hospital was ready. So we had a place for the people. We had ventilators. We had personal protective equipment. We had everything that we should have in place. And we've been ramping up our supply since then, including what I just mentioned to you, that we are launching our molecular laboratory next week here to test locally, and this is NCDC accredited laboratory.
Not just in Nigeria, but globally, there's a big conversation about the economies taking a big hit. So for a state like Ekiti, where, you know, it wasn't as if there was a big oil well in your backyard to start with, and anyway, oil is tanking, as I gleefully announce all the time, you know, what are Ekiti's own post-COVID economic plans in particular?
Well, our first priority really is to ensure that livelihood is not threatened. Yes, we want to save lives, but people must also survive. They must continue to eke out a living. And for us, we have a priority of keeping our workers, for example, in jobs, especially productive jobs, where we also have a commitment to our small and medium scale enterprises, because that's where the bulk of our own business people are. We're not Dangotes in Ekiti or all of these big enterprises. But so, and one of the critical vehicles we're using for that is agriculture. We're known mainly for two things. You mentioned one earlier, education. The other is agriculture. We're agrarian. And we feel that this is an opportunity for us to really break out of our seeming attachment to subsistence farming, to commercial agri-business. And that's why we're really getting into Ekiti. A lot of the big players in the industry, Promasido is here now, helping us to resuscitate our old dairy farm. Dangote is there for our rice farm. Stallion Rice is here, setting up rice mill. We have people setting up cassava mills in the state. So bridging the gap between these big-time commercial farmers and our outgrowers, who are also out there, young, dynamic farmers who need just a little bit of support from state, with land clearing, with hybrid seedlings, with little support that would help them move from farm to market. So we're constructing roads from farm to market with the World Bank support, so that all of these things can come together and we can develop our agricultural sector a lot better than it is now, and it can generate more resources, independent resources for those who are keen to go into agriculture rather than waiting for employment that is not there. The second area for us is developing our knowledge economy. We are already, as you say, a state of professors, but you can have education and not really use the education to create wealth. As we move into a new world, the job of the future is going to be a different type of job. I've been stuck in Ekiti for the last 2 months, and I've been conducting meetings like this as chairman of the Governors Forum. I meet 36 governors every week, and we do it on WebEx, on Zoom, on Microsoft Teams. So that's another way of working. If it were to be in the past, Funmi, I will carry my convoy, drive all the way to Abuja with many officials, put them in hotels.
I was going to
that
ask
really
you
would
that
change.
Going forward,
I can tell you it will change. I can tell you without any hesitation that it would change, because we've also seen the value in this. We've been able to work without necessarily overstretching ourselves, wasting time on inanities, rather than concentrating our energy on things that would be much more productive for us. So there's a new normal, a new change out there, and we've got to adapt to it. We've got to respond to it, even in the economies that we build, in order for the future to be rosier for our people.
I thank you very much for joining us this evening and spending time with us. Good luck with it.
Thank you, Funmi, and welcome back.
Thank you. Thank you very much.